So, what is a non-diet dietitian or HAES dietitian, and how can they help you improve your overall health without prescribing weight loss? My name is Shena, and I am a non-diet dietitian specializing in the care of persons with eating disorders. And we're going to dig into some of the ways that a non-diet dietitian is different from a traditional dietitian, and how can they actually help you improve your overall health without focusing on weight loss. So, there are two things that make a non diet dietitian different from a traditional dietitian. The first one is that they understand that lower weights do not actually improve overall health outcomes. So, when you visit a non diet dietitian, you're never going to focus on weight loss as part of your healthcare intervention or management of a medical condition. The second thing that a non diet dietitian does differently from other healthcare providers is that it doesn't promote any type of food restriction that is not medically necessary. When we're talking about medically necessary food restriction, we're talking about things like diagnosed allergies. And a non diet dietitian will help you work through a medically diagnosed allergy. It's like non diet dietitian and HAES dietitian, which stands for a health at every size dietitian, are often used interchangeably, and they're pretty much the same thing. These two terms just mean the provider does not practice from a weight-centric perspective. A weight-neutral dietitian is going to do everything that a traditional dietitian would normally do. So a non-diet dietitian will still be practicing medical nutrition therapy, will be helping you to manage conditions such as diabetes, heart disease, and kidney disease. The only difference is they're not going to be weight focused. So the non-diet dietitian is actually really going to be focusing on how do we shift the foods in the diet or manipulate what is had at each meal and snack to actually improve health outcomes. So for example, in somebody with diabetes, we're going to be doing things like looking at how much carbohydrate is in a meal and snack, looking at total fiber intake, those parameters that are actually going to help to improve blood sugars, A1C levels, without ever necessarily mandating weight loss. I often do hear things like HAES or non-diet dietitian being interchangeable with things like eating disorder dietitian. Now, these actually are not the same thing. An eating disorder dietitian is a dietitian that specializes in the care of persons with eating disorders and works with a clinical team to help manage those eating disorders. And there's a very specific set of skills and supervision that is required to be an eating disorder dietitian to keep those patients safe. Now, I will say almost every eating disorder dietitian is also a non-diet dietitian, but the same doesn't go in reverse. Not every non-dietitian has the skills to work with a person with eating disorders. In fact, a non-diet dietitian might have a totally different specialty, like helping somebody manage diabetes through the weight neutral lens. A non-diet or HAES dietitian is an excellent approach because it actually promotes safety in the atmosphere and lets the patient know that there's not going to be any weight bias when they come into the office, which can help to improve compliance and health outcomes overall. If you found this video helpful, please consider liking, subscribing, and sharing with a friend.